So if you're looking at seeing a chiropractor, I'm going to run a couple of things to try to make you want to choose the Chiropractic Health Centre as your primary healthcare. The main elements that we've chosen to invest on initially when I opened this practice is an X-ray machine. It's very, very common for patients to come and see us having had lots of therapies on their back, on their neck, and not exactly knowing what the situation is like, what the diagnosis is like. So what I'd like to do briefly is run through a couple of x-rays with you and make you understand why in some situations you're not even expecting to find some phenomena, and you would through only an x-ray, not on palpation, not on theory of diagnosis, through history, but definitely just by imaging. Okay? Okay, this is an example of a 32-year-old male. No history of any traumas to his back, chronic backache, but nothing that would externally show us that he would have what you find on the x-ray here, which is a very pronounced mid-dorsal scoliosis starting here on the low aspect of the neck. The importance and the benefit for us chiropractors to have a picture like that is obviously we know where to act, but we also know what to tell this patient, how much improvement we can get and how much limitation we'll have in the treatments. Here, second picture, from the side of his neck, the lordosis of his neck should be like this. The curvature should be like that. As you can see, it's going very much forward. Complete reverse cervical curve, putting obviously a lot of mechanical pressure here on the lower neck and on his shoulders. But also, if you look deeper at those joints here, you can see that the lordosis, the curvature which is deformed, is being caused by degenerative issues here. So things that you'd find usually in older patients. So without an x-ray of this man, you would never guess that his neck would be looking like that. Of course, you can imagine the gratefulness of someone when a diagnosis is made, as opposed to saying that he's slightly stressed about his neck, and that's the reason why he's get back tension. This is quite pronounced phenomenon, and obviously needs very specific attention. Okay, another example here of a middle-aged man suffering with chronic back pain. On an x-ray of a pelvic x-ray like this one, you'd look at the hip shape and obviously bone density, so arthritis, no arthritis. You'd be looking at the balance of the pelvis, which is reasonable in here. You'd also be looking at something essential, which is the number of vertebrae and the junction between that vertebrae and the sacrum, because this is a site where a lot of congenital deformities happen. So people suffering from chronic back problem from the age of 25, 30 don't even know they are living with one extra vertebrae or vertebrae semi-fused here, not fused on the other side. So all that again explains a lot of the symptomatology. But the reason why I showed you this x-ray in particular is because there's something on palpation you wouldn't understand very well unless you had an x-ray, and this is this fact. You see the ilium here, one part of the pelvis is wider on this side than this side. It's not because it's actually a bigger bone, it's only because this ilium here is rotated externally, creating a very tight sacroiliac here, very tight musculature. Without knowing about this, you would not give this person the right stretching exercise. You would not guide him properly with regards to stretching, but also muscular work that could stabilize his back problem. And also, you would probably not explain the fact why he would, despite therapies, he wouldn't feel 100%. Okay? So I thought that was a relevant picture to show you today. Thankfully, those two examples have shown you the benefits of having x-rays. I must admit that in 15 years, I've not had one single patient not being extremely grateful that we went that little step forward in understanding their back issue. So I hope that will push you towards choosing us as your chiropractor, and we're looking forward to hear from you soon.